you for waiting and sorry for the bit inconvenience due to the network. Actually, we had tried to make the experience more pleasant for you, but unluckily there were some network problems. So back to the basics and to the basic streaming. So today I will like to answer your questions, the international patients as well as the national ones. Can someone help me with a laptop over here so that I can also see what kind of questions are being asked? Raghav, can you please log in the another laptop and place it over here with me? This one, this I would like. So we are going to today discuss about diet. Diet, which is the most important requisite in a patient, and we are going to start with the HIV diet today. HIV, if we talk about epidemics, there was a time when epidemics used to be really life-threatening for people. Then there came the era when with the development of proper antibiotics and all, those epidemics, those infections and all, they got, you can say, wiped off. And today in this era, the biggest disease of the, you can say, century, leaving aside cancer, is HIV. Now, when an HIV patient approaches us, the first thing which I always guide my HIV patients is, do not run after fake commitments. Often HIV people are given fake commitments. What I always advise my patients is, whether you are getting treatment from us or you are getting treatment from anywhere else, CD4 count needs to be regularly compared. Again, the viral load needs to be regularly compared. Mr. Harinder, can you please close the door for us? You have opened the door. So it needs to be regularly compared so that a person knows that if she or he is taking treatment from anywhere in Ayurveda, they are benefiting. I will repeat in Hindi. वो जो व्यक्ति किसी प्रकार का इलाज करवा रहे हैं HIV के लिए, कृपया अपना CD4 काउंट और वायरल लोड रेगुलरली कंपेयर कीजिए, ताकि कोई भी व्यक्ति आपको गलत कमिटमेंट नहीं दे सके. चाहे आप हमसे इलाज ले रहे हैं, चाहे किसी से इलाज ले रहे हैं, एक डॉक्टर के लिए भी ये जानना बहुत ज़रूरी है कि उसके पेशेंट को कितना फ़र्क पड़ रहा है, और आपके लिए भी ये जानना बड़ा ज़रूरी है कि क्या ये इलाज हमें बेनिफिट दे रहा है. डॉक्टर संजय, प्लीज़ कीप ऑन रिप्लाइंग टू ऑल द कमेंट्स. हमारे जो व्यूअर्स हैं, जो रेगुलर हमारे पेशेंट्स हैं, एज दे अप्रिशिएट अस, प्लीज़ आप उनको एक्नॉलेज जरूर करते जाइएगा. एंड थैंक्स ऑल ऑफ यू जो हमें अच्छे कमेंट्स दे रहे हैं. इट्स इनकरेजमेंट फॉर अस. सो HIV डाइट की हम बात कर रहे हैं. कमिंग टू HIV डाइट, अगेन वी हैव टू स्टिक टू द बेसिक्स. यहाँ मैं खाने के तरीके की बात भी करूँगा, दैट इज़ आई विल टॉक हाउ टू ईट. बट देन यहाँ पे हमारे पास एक क्वेश्चन आ रहा है पित्तज संग्रहणी के बारे में. पित्तज संग्रहणी के बारे में पूछा गया है. मैं बताना चाहूँगा कि पित्तज संग्रहणी में जो हमारी ग्रहणी है, जो ड्यूडेनम है, ड्यूडेनम इन्फ्लेम्ड है, और आयुर्वेद में ग्रहणी के बारे में बोला गया है पक्वाशय और मध्य जो आमाशय है उसके मिड में ग्रहणी होती है. षष्ठी पित्त धरा नाम या कला प्रकीर्तता, पक्वामाशय मध्यस्था ग्रहणी सा परिकीर्तता. सो कभी भी किसी को ड्यूडेनाइटिस हो गया है, पित्तज संग्रहणी हो गया है, आयुर्वेद में बेल का सेवन बहुत अच्छा है, आप बेल का सेवन कर सकते हैं. और डॉक्टर संजय इनको आगे फर्दर चीज़ें गाइड कीजिए, बहुत अच्छी हैं. सतीश जी वाइजैक से आप जो पूछना चाहें, बिल्कुल यू कैन प्रोसीड विद योर क्वेश्चंस एंड you can directly call us also on our helpline number 9988882526. International number, sorry we are unable to display right now, but all of our international viewers, they know our helpline number. So Felix, doctor, please can you speak in English? Yeah, Felix, I'll try to be in English. Actually what I'm trying to do right now is that if someone is asking question from me in Hindi, I'm trying to reply back in Hindi, and if someone is asking in English, I'm trying to be in English. So the question which is over here is HbSAg, can it be negative? Yeah, surely. See, if right at the onset I commit something, it will be fake. But then what we need to know over here is that HBsAg carries tighter values. That is the value, how much positive it is. If a person is HBsAg positive, that person should know the value of HBsAg for which he or she is positive. And the person can also keep a check on the viral load, the HBV. If a person wants to have a hepatitis B free life, for that a person can regularly go for a HBsAg test and HBV DNA test. If both these tests are done, Harjeet ji, can you type the helpline number? Yeah, Mr. Felix, Harjeet ji has just typed the helpline number for you. You can also note down our helpline number. And along with that, what you should know is that HBsAg. HBsAg is something which is pretty important over here. It should reduce. If you are suffering from hepatitis and if HBsAg is coming down with any kind of treatment and HBV DNA is coming down with any kind of treatment, it means that the treatment is working for you. And yes, with the help of Ayurveda, a person can be hepatitis free. Again, coming back to my diet for HIV, I would like to tell that if a person is to get the question is, but it is chronic condition, how many time is required for HIV negative? See, the biggest thing which is to be known over here is there are so many fake commitments that are done around the globe in regards of HBsAg. To be honest, see, how much time it is going to take entirely depends upon how much is the titer value. For example, if the titer value of a person is very less, that person is going to be cured very quickly. If the titer value of a person is moderately high, that person is going to take more time. And if it is too high, it may take even longer time. If I talk about the cases, I have cases who were able to lead a disease. If I talk about patients where the time was more, they would take 1 year, 2 years, 3 years also. So minimum of 3 months, a maximum of 1 year, 2 years, 3 years. So the time can vary from patient to patient. But then to know the exact time, the best method which we advise is go for a HBsAg level test or a HBV DNA test immediately when you start with our treatment. And you can again go for a test after 2 months of treatment. Now, if these two tests are compared, you as well as we will come to know how much your condition has improved. So, by the help of that test, we can estimate how much time it is required for complete recovery. Okay, I hope I have made the things clear. And thing which I want to commit over here is that if we are indulging into this treatment, we do not blindly do it. We always go for it properly, technically, with the safest herbal combinations, and the results we compare so that our patients also know and we also know that yes, the patient is improving. So, coming back to diet, I was talking about diet for a HIV patient. The first thing that a HIV patient is to remember is that more processed the diet, the worse it is for the patient. That means that the more we stick to a raw diet, the quicker we get recovery with any kind of medicines. Talking about the oil, we all are in a habit today of fried things, processed things. If at all you really want that the cooking, the fried thing which you want, that fried thing is to be taken, that is to be taken fried in sesame oil. That is the til ka tel. Priya Vinodji, as far as the information of brain tumor is concerned, we would like to know certain things. We are having ND Care app which is on Google Play Store. You can download it. If there is any latest PET scan of your brother, we will like it. If there is any MRI, we would like it, because we need to know whether there is any kind of midline shift or not. Along with that, we also need to know whether any chemo, radio, any kind of other allopathic treatment is going on, and exactly the condition of the patient. Because if we really want Ayurveda to work in that case, it should be a really very quick Ayurveda. So what we can promise from our end is, in case we get the reports of your brother, in any case, we will advise you with the right thing. We will never misguide. It does not matter to us from where you are taking treatment. What matters is that if you are in Ayurveda, you should be guided the best. That will be my try. So please share the reports so that I can advise to the best of my knowledge. Again, coming back to Priyaji, allopathy and all the details, Dr. Sanjay is over here with me. Dr. Sanjay is just going to continue the chat with you, and once we get all the details, immediately after this live session, Dr. Sanjay will be connecting to you to take all the details, and we would definitely like that we can do all the help in this case that we can. Please help us with your contact number, your details, and you can also upload the reports on our ND Care app. So coming back to Nicholas Daniel, I am Jack Daniel, doctor. I have multiple kidney cysts. See, Mr. Nicholas, as far as the kidney cysts are concerned, generally kidney cysts are a genetic problem. They carry in families. And if we talk about Ayurveda, depending upon the condition in which a patient is right now, there is a lot that can be done with the help of Ayurveda. The thing which is important over here is that if those cysts have deteriorated the kidney functionality, then we need to give two kinds of medicines. One for reducing the cysts, the second one for improving the kidney function. And if the problem is only with the cyst and the kidney function is still okay, then we only give medicines for the cyst. So there is a lot that Ayurveda has an offer for you. The thing which you have to remember is, whether from us or from anyone else, stick to herbal Ayurveda. Do not take any kind of metals. Metals are not very good. Again, coming back to the HIV diet, we are to go for sesame oil, til ka tel. If sesame oil is used for cooking, sesame oil, the best part of it is that it is Ushna. Due to its Ushnata, HIV being a thermolabile virus, the Ushnata of til ka tel really works wonders with HIV patient. So if sesame oil is given, automatically the habitat is destroyed for the HIV virus. It is unable to divide. So all my friends who are suffering from HIV, please stick to sesame oil for cooking rather than cooking in any other oil. Again, since I am talking about diet, another important thing to note over here is that the more the home food, the better it is. So junk food like burgers, pizzas, they are really not that helpful. Dr. Sanjay, please keep in mind, in case I miss out on any question, you can repeat out the question, or Sumit, you can repeat it out.
Kalra is asking about creatinine is 1.8 and he is a CKD patient.
See, if the creatinine is 1.8 and you have been diagnosed with a CKD, one thing, my friend, which I would like to tell you over here is, do not ignore it. Generally, doctors will keep on guiding you that if you are having a creatinine of 1.8, they will pile you up with a diuretic, they will give you a calcium supplement, they will give you any antihypertensive medicine if it is required in your case, they will give you antacids, but they won't give you a single medicine which is good for protecting your kidneys. Go for a 24-hour urinary creatinine clearance test. That is something which is important. So 24-hour urinary creatinine clearance test is good for you to exactly tell you how much your kidneys are working. And along with that, there are certain protective medicines which we have specially developed, one of them being Uramrit. You can immediately start them without risk. My team will be guiding you with the same. Along with that, certain kitchen remedies which my team will like to guide you. They will be in contact with you. Please share your details. You can also upload the current reports which you are having. But again, I will repeat, the test which is important for you is not just serum creatinine, but creatinine clearance test. Any other question which I have missed?
Amir is asking about can he drink tea or coffee? He's hepatitis B positive.
See, if you are only positive, Mr. Amir, you can definitely drink tea and coffee, but only once or twice in a day. But if you are also having a liver damage along with being hepatitis positive, if it is any kind of fatty liver, any kind of liver fibrosis or something which the virus has done to your liver, in that case, you should not take tea or coffee. Otherwise, for a simple hepatitis positive patient who is not having any kind of liver damage, taking tea, taking coffee is not at all harmful. मेरे वो सारे दोस्त जो भारत से हैं और मेरी बातों को नहीं समझ पा रहे हैं, मेरी रिक्वेस्ट है आप सबसे, मेरे क्वेश्चनियर के दौरान आप लोग मुझे हिंदी में भी क्वेश्चन पूछ सकते हैं. अगर आप मुझे हिंदी में प्रश्न करेंगे तो मेरा जवाब हिंदी में रहेगा. एंड इफ यू विल आस्क मी अ क्वेश्चन इन इंग्लिश, माय आंसर शैल रिमेन in English. So, any question which I have missed?
Meenakshi Jana is asking that HbAc negative हो गया है क्या? Viral load 9.013 है. What can be done?
See, if HbAg is negative, that means कि viral load should be negative. If the HbAg is coming down to negative, then the viral load cannot be positive. Please go for retests. Do not confuse HbAg with HbEag. It is hepatitis B envelopant. Don't confuse it with it. See, as far as any supplements that are being taken and if there is any kind of pain in leg, do not relate it to the supplements. Please give full detailed history. Dr. Sanjay, please take full detailed history of the patient where there is pain in legs. We need to advise some kind of antioxidant, some Ayurvedic antioxidant like ashwagandha or something of that sort can be added in this case, which is good. Can you help me out with the next question, Mr. Sumit? There was a question which I just missed about cancer.
Mr. Ram is
Mr. Ramratan.
Yes.
Mr. Ramratan, I have been updated that you are suffering from cancer. First of all, brother, our thing which I would like to tell you is in cancer, a disease where the full world is commercialized, what we prefer over here is we always try guiding the best. You can fearlessly forward your reports to us, your details to us. What we will try to do over here is that we will give you the best of guidelines in multiple myeloma. We need to have further details. There are so many Ayurvedic drugs which work really good in multiple myelomas, but we need to see where exactly those myelomas, the tumor marker test, PET scan if any. Please forward us the same. You can give us your contact details over here. We will be getting back to you after the live show. Or you can download ND Care. The app's name is ND Care from Google Play Store. You will be guided properly. But over here in the short time that I have, I can assure you, my friend, that there is a lot that Ayurveda can do in multiple myeloma. But do not run after quacks. Open your eyes. Select the right doctor. Beat us, beat anyone else. That does not matter. But it should be the best. And you should regularly compare the things. There was a question about Parkinson's also while I was listening over here. See, when we talk about Parkinson's, it is the neurotransmitter level in our brain which gets depleted. And the allopathic drugs, they give that neurotransmitter artificially. See, what exactly is neurotransmitter? Neurotransmitter is you can say chemical which transmits the message from one nerve cell to another nerve cell. So when in Parkinson's, those chemicals they get depleted. As a result, the brain cells, they are not able to transmit the message from one cell to the body. As a result, trembling, loss of control, loss of movement, it starts. And the allopathic doctors, they guide the patient with Syndopa and dopamine supplements at that stage. I do not discourage those. I nowhere say that those supplements are not helping people, but then that is a temporary kind of recovery that they give. In Ayurveda, it is known as Kampavad. And Kampavad, to be very honest, is curable. At least 70-80% curable. A person suffering from Parkinson's can get very quick recovery with Ayurveda. But do remember, when you are taking Ayurveda, go for sealed Ayurveda. Don't go for open Ayurveda. choose the right doctor, see what exactly is there in the medicines that are being given to your patient. You can also go for Panchkarma. We are having the best of Panchkarma centers in various parts of India, out of India. You can go for Panchkarma treatment also. Again, it is very helpful. So do not worry, for Parkinson's. We are having the best of treatment, and not just us. Ayurveda is having very good treatment.
Emmanuel is asking, he is having HIV, he's taking treatment but he is getting heat sensations and difficulty breathing.
See, Mr. Emmanuel, when we talk about any kind of HIV treatment, we definitely increase the level of pitta inside the body. As the pitta increases, so a bit of heat increases. So what we will do in your case is that we will add a body cooling medicine in your case. Dr. Sanjay, please note, we can add either Kamdudha Ras or Mukta Pishti or Toxicare in Mr. Emmanuel's case, and that Mr. Emmanuel will definitely sort out the purpose. Try taking more of milk, try avoiding spices, that definitely will sort out this problem. And in case still it persists, you are welcome on my next live show, because I will always try to connect with everyone every week. So another question if we are having.
Nana is asking that can hepatitis B completely vanished?
See, when we are talking about hepatitis B, definitely it is curable. The thing which we are to remember, don't believe on anybody's words, not even on my words. Believe on what the tests have to say. Whether you are taking treatment from anyone, if a doctor is authenticated, he will always advise you to keep a check on the tests. So, go for HbS-Ag titer value regularly, and along with taking HbS-Ag test, you can go for HBV DNA also, and keep on comparing those, so that you know that yes, the triple mode action medicines that are being given to you are really working in your case. Dr. Sanjay, I just saw a question related to nephrotic syndrome.
Nosheen Khan is asking about what are the don'ts for nephrotic syndrome. She's a
See,
patient.
Nosheen Khanji, whenever we are talking about don'ts for nephrotic syndrome, all those things which are body heating in nature, be it the lifestyle which is body heating, be it the diet which is body heating, all are really harmful. So when I talk about body heating lifestyle, it means roaming more in the sun, over exercising, being more of angry, and body benefiting diet lifestyle means doing Sitli pranayam. I always do it for my patients like this. Sitli pranayam is something which is really good for you. It works miracles for nephrotic syndrome patient. Then the cardamom, Elateria cardamom, the small elaichi seeds are very good for a nephrotic syndrome patient. The things which are harmful are Ushna Virya medicines like Piper longum is not good. Then anything which is warm, which is body heating, needs to be avoided. Pineapple juice needs to be avoided. Then diet which is very containing lot of spices and all needs to be avoided, and being hungry also needs to be avoided. Take lots and lots of fluids. If I talk about sharbats, then sandalwood sharbat is very good for you. If you can get a sandalwood syrup, it's very good for you. Take it regularly and keep a check on the 24-hour urinary protein excretion. Next question.
Raghavan's son is 32-year-old and he is a kidney patient, and doctor has recommended his transplant, but he is...
See, Mr. Raghavan, I am not against transplantation. If a stage is such that transplantation is required, that is the urine output is nil and everything has been tried, I am not against it. But then a transplanted kidney generally has an average lifespan of 8 or 9 years, and the son is too young. So try if the kidneys can be revived. What I can commit you from our end is, we will see the reports, we will see the details. It's only if we see hope that we will give something to your child. Otherwise, we will not give anything. Because what is important in a kidney patient is that if anything is being sent inside his body, it should be really safe. No metals, no chemicals. We are to keep a check on potassium, phosphorus, every level. So we will maintain the utmost cautiousness, which we always do in any kind of patient who is suffering from kidney problem. So send us the details. We'll try that you don't have to go for a transplantation and we can revive the functionality that the kidneys have lost. Next question.
Michael is asking for the exact duration when hepatitis will go completely.
Mr. Michael, as I already answered this question, I will again answer it for you. I have cases where the patient became the disease free in 3 months. I also have patients where it took 1 year. I also have patients where it took 3 years. It entirely depends upon the HbS-Ag levels. I also saw a question during this live stream where I was asked whether HbS-Ag can be cured in a month. To be honest, there have been very few patients where it did happen, but I never commit that, because if it is happening in say 5% of my patients, I will say no. What I can say is that yes, you can be disease free. Miracle Ayurveda, committing wrong Ayurveda is the work of those who generally follow wrong ethics only for sale. Another thing which I would like to update to all those who are listening to me, I never do telephonic conversations. Around the globe, people may commit you fakely that the treatment is being done under me. See, I am having a team. I work for at least 19 to 20 hours a day to live up to the expectations of all those who come to us for Ayurvedic treatments. But if you are being committed that the treatment is running under me, it's not possible for me to give treatments to lakhs and lakhs of people altogether. So those who meet me, those who ask questions from me, in the answer those questions. I am able to take those cases in those live streams, but those cases where the patient is approaching by different methods, it's not possible for me to give consultation. So if you want to discuss your case with me, the best method is, which is absolutely free of cost for everyone, ask a question during these live stream sessions of mine, because Rajkumar, he is giving me a call again and again. Ask him. Because each and every question that is asked from me during these live stream sessions of mine, after these sessions, I sit with them, speak to me directly, then time to time, yeah. We are back live, and sorry for the brief interruption that was there in the connection. And what I was telling you, I will again repeat it for all of you. Since there were interruptions, I'll try carrying this live stream session more than 30 minutes so that you people can ask your questions in a better way. Next question, can you help me out with the same?
Nicholas is asking that kidneys and livers are functioning well, but my problem is that kidneys having cysts.
See, Nicholas, do not worry. Since your kidneys and liver are working perfectly all right, that means we only need to give you with certain therapies, certain guidelines, certain home remedies, and certain supplements for reducing those cysts, so that those cysts do not increase and do not damage your kidney. So do not worry. There is a lot in Ayurveda that can be done for you. Next question.
संतोष जी डाइट जानना चाह रहे हैं हेपेटाइटिस बी की.
संतोष जी, आप डाइट जानना चाह रहे हैं हेपेटाइटिस बी की. मैं आपको बताना चाहूँगा, बाहर के खाने से बचिए. पिज़्ज़ा, बर्गर्स वगैरह बिल्कुल मत खाइए. जितना घर का खाएंगी उतना अच्छा है. लेकिन हेपेटाइटिस पॉजिटिव होना मतलब ये नहीं है कि आपको जॉन्डिस हो गया है. तो बिल्कुल उबले पर नहीं आना. घर का खाना आप खा सकते हैं, लेकिन लघु और सुपाच्य हल्का खाना रखिए. हैवी डाइट मत लीजिए. सो नेक्स्ट क्वेश्चन. So I was telling all of you that there are 3 methods in which I always try to connect to my patient. One is through these live stream sessions of mine, where I always try that after each live stream session, all the questions that I have from my patients, I sit with my team and personally try giving consultations to all those patients. The second method which can be done over here is that you can go for a session, a live session, which is a video conferencing session where you can speak to me. The third thing which can be done over here is that you can meet me in one of my OPDs. All the things which I need to tell you over here is that during entire of this consultation sessions, I will always try to give the best of guidelines to all of you. See, Ayurveda at times is mistaken by people that it is a miraculous thing. Yes, miracles do happen in Ayurveda. But for those miracles to happen, your doctor should give it the best. You should give it the best. It's a combined effort of both the doctor as well as the patient. If proper guidelines are followed, if proper Ayurveda is taken, definitely the recoveries are always very good. A hepatitis person, if I talk about meat, see, I personally feel is avoid meat, because if a person is taking meat, it's not very good for the person, because any kind of viral infections they increase with meat. As far as the Delhi OPD is concerned, I would like to update you. My proper Delhi OPD shall be on 30th. However, I am passing by for certain OPDs to Delhi. So any emergency case, if is there, I can meet that case on 12th. Otherwise, the proper OPD is on 30th. Can you please again repeat any question if I have left with any question?
Hepatitis diet again and again asking.
करण जी माफ़ी चाहूँगा, एक्चुअली जो हमारा आज वाला सेशन है ये हमारा इंटरनेशनल सेशन है, इसी कारण से मैं थोड़ा सा जो है वो हिंदी की जगह पे इंग्लिश का प्रयोग कर रहा हूँ. मेरे जो जनरल हिंदी वाले सेशंस होते हैं आपको उसके लिए भी हम अपडेट करेंगे और वो कम्प्लीटली हिंदी में रहेगा. हाँ, अगर आप कोई प्रश्न हिंदी में पूछते हैं तो उसका जवाब मैं डेफिनेटली हिंदी में ही दूंगा. सो माफ़ी चाहूँगा, आज का सेशन क्योंकि इंग्लिश में है तो जो क्वेश्चन हैं वो इंग्लिश में चल रहे हैं. द नेक्स्ट question which I any question which I have left with, or can I continue with my talk?
Bangalore.
When are you coming to Bangalore?
See, the Bangalore OPD curriculum, all my OPD curriculums, otherwise in Bangalore I will be coming around 21st or something. You can speak on the helpline number also. Dr. Sanjay, can you please answer in case you are having the Bangalore OPD details? And all these things are available on our ND Care app also. Please download our app. You will get each and every slightest of information on our app. And I was talking about HIV diet. I would like to wind off with my topic today of HIV diet by saying that all kind of processed foods, which if taken, they really boost up the virus. They bring our immunity down, as a result of which the virus multiplies. So if you are an HIV patient, please try in that case that you remain on a non-processed diet. Another thing which you have to keep in mind over here is that along with the unprocessed diet, the second thing which have to be kept in mind over here is that if we go for more of raw vegetables, if we go for more of fruits, that is more good. And go for raw vegetables, go for fruits. Do not go for processed things. The more the fried, the worse it is. Again, being vegetarian always helps a HIV patient. If a patient is more into a vegetarian diet, that is always good for a patient, because being vegetarian automatically helps a patient. सुनील यादव, अनिल यादव जी, बिल्कुल अगर आप 2 महीने से हेपेटाइटिस का इलाज करवा रहे हैं तो कृपया HbS-Ag टाइटर वैल्यू करवाइए और इसके साथ साथ आप HBV DNA भी करवा सकते हैं. आप ये 2 टेस्ट करवाइए, आपको डेफिनेटली लाभ मिलेगा. इसके बाद अगेन आई एम कमिंग बैक टू द HIV डाइट. आई वॉज टॉकिंग अबाउट HIV डाइट. HIV डाइट, since we were talking about the question upon being vegetarian and being non-vegetarian, do remember the best diet in a HIV patient is being vegetarian. Try being vegetarian, it will definitely help you out in HIV. Try taking warm water. Warm water is very good for you. So thanks to all of you for being online today. Immunity booster, if I talk about Ayurvedic herbs, Giloy is very good immunity booster. Ashwagandha again is very good immunity booster. Again, Piper longum, which is known as Mage, is very good immunity booster. So these are the common things. There are supplements around the, you can say, table available throughout the Ayurvedic world. If you are going to go for any supplement, we too also are having a supplement on the name of immunoneurogams. You can always go for it also. And other good supplements also you can always take. But do remember, if you are to take any kind of Ayurvedic supplement, you should know what exactly is there in that supplement. Take the contents of it and only then take it. It should be safe for your body. So, thanks to all of you for being online today. We will further carry on this series of online talks with you. I will always try to answer your question to the best of my knowledge. I will try to give you the best of guidelines. Stay tuned to the channel, subscribe the channel, enable the notification and the NDCare app. Do remember to download the NDCare app. Thanks to all of you. Stay healthy, stay blessed. Thank you.